My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and I have here with me one of my good friends and our client, Josh Renken from Renken Dentistry.
Yes, sir.
Welcome, Josh, to our show. And we're truly excited about this conference. It's been so amazing. A lot of amazing speakers. You were on the panel yesterday talking about your challenges in growing your practice. You know, you've got these four amazing super GP practices and growing the right way. And you've learned some lessons over the years on what not to do and what to do. So talk to us about some of that stuff. Not everybody was on your panel yesterday. What lessons did you learn over the last few years as you were scaling your operations?
Well, I think one of the first questions that we talked about on the panel was, what's been the biggest lesson? And one of the things that I think, I guess the easiest way to understand the lesson that I've learned is, when I started years ago in a solo dental situation, one of the things I did for myself was I made a list of all the non-negotiables that I would never compromise as we grow.
Sure.
And the funny thing is what I learned is that list started to get shorter because there were certain special things that were harder to replicate and carry on as we grew.
Sure.
But the things that have remained on that list, I think, are what make us special and are what's super important, and the things that I never want to compromise, and I only want our growth to make them even more special and to make them more fully expressed. So, that's probably one of the biggest lessons I've learned from growing, despite a lot of the other pains. But certainly, big lesson, having some things that are just non-negotiable that I will not compromise as we grow is important.
Like an example would that be clinical excellence, right? Non-negotiable.
Clinical excellence, our patient's path to health, our fish school program for kids, our health assurance program to move patients to health. There's a variety of our internal Smile from Within program for our team members. All of that.
How much do you focus on patient experience?
That's ultimately all of those unique things that we are non-negotiable going to stick to. Most of them impact the patient fully, and then it's part of their experience. So the experience is huge, and frankly, that was one of the things that as a practicing dentist, you're very involved clinically for years, right? Even as you start to grow or expand.
Right.
But as you start to grow, you're away from your admin team. That's the
Absolutely.
one part that we never get to see or experience or feel because we're back clinically and we're working with our clinical team. So, and that's where we ultimately reached out to you for some success. But yeah, that's all of the patient experience. The whole patient path is important to us.
And how have you built your team? And it's really important to build a good team because you can't really do it all.
Sure.
What have you done, and how have you engaged in hiring team members before you needed them? Because a lot of DSO guys will tell me that you've got to really hire people ahead of growth.
Sure, right. And I would argue I would love to say that we're ahead of things, but I know in some ways we're not. But I guess to your point, how do we develop our team? I feel like the number one thing that we had to centralize first was our vision of where we're going, our mission, and our values. Without that, that literally forms the framework for our hiring process, our development program over time that we're trying to build. It helps us, in a variety of ways in terms of, helping inspire myself when the going gets rough, but also inspiring our team beyond my reach of what I can control.
So what's next for you? What is the next year for? What's the goal for 19 or maybe 2020?
Well, we have a fifth practice opening up in Austin, Texas,
Fantastic.
Which is exciting because there's, Austin's a big, booming, growing place.
Absolutely.
We have a wonderful group in Illinois, and that team is growing. We're expanding right now, going through a construction project, and seeing those practices grow and continue to expand when they were really where we started. Is fun. Those certainly haven't plateaued, so we're seeing that grow.
Nice.
And just honestly, my deepest intention is to continue to grow those special things that make us unique in the way that we impact the community. Continuing to make sure the expressions of our values, the way we treat patients, are just that much more emphatic and special, for them in their experience.
It's a great story. I think if you guys want to look what they do from a branding perspective, would they go to Renken Dentistry? That's the website?
Yes.
Renken Dentistry. Google them. Find out about how cool and unique they've built their practice. And I really appreciate this conversation. I'm looking forward to now partnering with you on our from our side and seeing what happens over the next few years. So thank you so much, Josh.
Absolutely, Amal. Thanks for your help.
Absolutely.
Yep.